Good evening, everyone. It's so great to see so many of you joining us. I invite you to say hello in the chat and let us know that you're here. We welcome you all and thank you so much for joining us tonight. My name is Stephanie Paul, and I am the Executive Director of MyFace, and I'm pleased to welcome you to our program today. This web education program is designed to inform and educate patients with craniofacial differences, along with their families and caregivers. We also welcome all the healthcare providers who have joined us for this presentation. But please note, continuing education credit is not available for tonight's program. Funding for this program was generously provided by the Louis J. and June E. K. Foundation. MyFace has a long history of providing access to comprehensive medical and dental care, along with education and direct patient services, paving the way for better patient outcomes. At the heart of our approach are three pillars of support. First, our grant funding to top-level organizations across the nation. We facilitate access to quality, comprehensive craniofacial care to help ensure that patients receive surgical, dental, psychosocial, speech, nutritional, and other aspects of care in a coordinated fashion. Second, through our range of direct services, MyFace aims to meet the day-to-day needs of the craniofacial community by offering groups for individuals with facial differences and their parents, distribution of newborn care kits specifically designed for babies born with a craniofacial difference, and housing for families who are traveling to New York City for treatments. Finally, we strive to educate patients, families, and healthcare providers through programs like this Transforming Lives webinar series and raise public awareness about craniofacial differences through our Wonder Project school assemblies and our monthly podcast, My Face, My Story, Voices from the Craniofacial Community, where individuals could share their stories, be seen, and be heard. MyFace is here to bring together the craniofacial community and help transform the lives of children and adults living with facial differences. We believe everyone deserves the chance to thrive and live the best possible life. And now on to our program. We have two presenters and a featured family today. Our presenters are Dr. Meredith Albert, who is a pediatric psychologist with the Cleft Craniofacial team located at Shriners Children's Chicago in Chicago, Illinois, and an assistant clinical professor at the University of Illinois in Chicago. And joining her is Dr. Janine Rosenberg, who is a pediatric psychologist and an assistant professor of clinical psychology and surgery at the Craniofacial Center of the University of Illinois Hospital and Health Sciences Systems, UI Health. We will also hear from the Hornbuckle family, including Mom April and children Terry Lynn and Evan. After the presentations, we will open the program for participant questions. As you think of your questions for our speakers, please enter them in the chat on your screen throughout the program. Please note that we are unable to address individual diagnostic and treatment-related questions during this program. These would be better addressed with your personal healthcare provider. It is now my pleasure to turn the presentation over to Dr. Albert and Dr. Rosenberg.
Good evening, everybody. We want to say hello from Chicago. That's where Dr. Rosenberg and I are located. And before we get started, just a couple housekeeping tasks. Neither of us have any disclosures to report. And we wanted to briefly address the objectives for tonight's presentation. First of all, we would like to define stress and what that means and the barriers to self-care or taking care of your stress. We're going to review strategies that promote the well-being of caregivers with a focus on stress management and self-care practices, as well as address the unique needs and challenges of siblings. We're going to also discuss communication strategies that foster a supportive environment that promote all family members' well-being, and we're going to review family support options such as counseling, support groups, and respite care. So stress is a pretty broad term, and there's lots of definitions out there, and it's a hard thing to narrow down and put into one small little definition. So we've pulled a couple different ideas of what stress means. The WHO defines stress as a state of worry or mental tension caused by a difficult situation. And when we say difficult situation, that can mean a lot of different things, because what one person finds difficult, another person might find quite easy to manage. It's really important to know that stress is a normal reaction to everyday pressures, but when it gets in our way of everyday functioning, it can become unhealthy and problematic. Stress doesn't just involve our brain and our cognitive functioning. It involves all different parts of our being, and it affects our bodies as much as our minds. And by causing those mind-body changes, stress contributes directly to psychological and physiological disorders and diseases, and affects our mental and physical health, reducing our quality of life. Stress can affect people of all ages, socioeconomic backgrounds, race, religions, and genders. And as I mentioned earlier, stress can look different for different people. We always think of stress negatively. And so I just want to put in the caveat that sometimes stress can be positive. And if you look at someone like LeBron James or a professional athlete, my guess is they feel a little bit of stress when they're getting started in their different competitions, but that stress can be motivating. And so the type of stress we're talking about tonight is the stress that can get really overwhelming and have difficulty. So two different types of stress that are important to recognize are acute stress and chronic stress. Our acute stress are those things that are short-term stress. My child has the flu and I have to miss a day of work to stay home with them. The toilet's broken and I have to get a plumber in to fix things. Or I'm going to miss work for a couple days because of this cold, or the flight was canceled at the airport, things like that. Chronic stress is more of our long-term stress, and it's things that are ongoing and can be present for long periods of time. So for things like, we have to have all of these surgeries. How are we going to pay for them? My partner lost his job and we have a lot of bills to pay and we need the expenses to be covered. Mental health diagnoses, financial, social difficulties, things that are going to be present for long periods of time, and people are going to learn to have to manage for the future. So when we think about management of stress, there's lots of different models out there. And this is one model that Dr. Rosenberg and I like. And at the center of it is the person and their well-being. And everything else manages around that. So step one would be recognizing stress. What is the stressful situation, whether it's a chronic long-term stressful situation or whether it's a short-term stressful situation. And then step two is, how do we manage that stress? And those are some of the things that we're going to talk about tonight. And then you move on to step three. Hopefully you get that stress and that situation better managed, and we can come up with more balance in our life. But then step four is where it's really important to continue to evaluate and continue to reassess of what stressors am I feeling in my life, what life events am I having a hard time with, and how am I managing those things, because they all affect our well-being. It's really important to remember these things happen in a cycle and that it's always continual, and we don't function in isolation. There's a lot of parts that go into taking care of how we're doing.
Okay. So thinking about this is just an example of a general model of stress, and that there are factors that influence the level of stress. And so you can see that there's a box that has individual factors such as family, finances, and then you have the environmental factors, economic environment, political environment, technology. Also with this is individual differences within each person, such as what are their beliefs, what is their experiences that they have, their social support. And then you want to think about what type of stress, because it could show up in different ways. So you have physiological stress, that's physical symptoms like headaches or backache or high blood pressure. And then you have psychological symptoms, the anxiety, depression, less low motivation. And then behavioral symptoms such as loss of productivity, and things that affect your behaviors day to day. So then when you think about an additional factor of having a child with a craniofacial condition, that kind of goes in its own category, which is why we're going to discuss more in detail. But how do the factors related to caring for a child with a craniofacial condition impact these different factors, individual differences, and the way that the stress is presented? So first, we're going to discuss burdens and factors that are specifically related to craniofacial care. So starting as early as a prenatal period, and when you might receive the diagnosis, or then when the caregiver and the family have to adjust after the diagnosis, that's one example. Even basic care, especially in the beginning, the feeding, their hearing concerns, if they're sleeping well, reflux, breathing. Then you have the medical care, which is ongoing, the craniofacial care team appointments, the surgeries and treatments that are involved, the orthodontic care, other doctor's appointments outside of the craniofacial center and within. And then therapies, they could be within school or outside, such as speech therapy, occupational therapy, physical therapies. Mental health kind of put in a different category, but that's another type of therapy, and that could be both for the child or the caregiver. And then logistics, transportation to get to the appointments, absences that you have to take from school and from work, financial burdens for the treatment at the care. Will insurance cover the different types of treatments? How to advocate for services in school and the community, which can also create challenges. And then management of learning services, that's referring to specifically within the school, how, what type of services that a child should receive, how to manage and coordinate all of that. Another burden is the interventions that might be involved for any bullying or teasing, and then how to get social support for your child. Caregiver responsibility for management care, who's going to do what? And then obtaining support for caregivers, and that could be within the community or within the family. And then at the end of the road, when it's time to transition into adult services, that's a big burden, figuring out how to do that smoothly and effectively. Okay.
So the question becomes, what is the role in care? Because these burdens really fall on everyone. The nuclear family looks different for many different people, and the burden falls on the patients in some level, and that looks different at different age groups. Certainly parents and caregivers, extended family members, and siblings. It's really important to note that everyone in the family has a different role, and that depends on your specific family. And as treatment providers, we always try to be really mindful of addressing families independently, because what looks familiar for one family looks different for another family. We have different setups with spouses, step parents, partners, single parents, a lot of involvement from grandparents, and even older siblings that are considered adults that can help in providing care for their younger siblings. And even close friends too are sometimes involved in care for kids. So one of the most important things in order to be able to provide care for your child is taking care of yourself. And so this is true for anyone. The next couple slides that we're going to talk about really focus on care for providers and caregivers for children, but it's really things that can be adapted for kids as well, some of these principles and some of these ideas. And self-care is just what it sounds like. It's taking care of yourself. And being that it's Valentine's Day tomorrow, I love that we have the heart on the slide, because it is so important to remember self-care isn't being selfish. If as a caregiver, you're not taking care of yourself, it is really, really difficult to be a good caregiver for your child or your stepchild, or even if you're a senior caregiver, whatever the situation may be. And so we looked at different definitions of self-care, and these are two that we both liked. So the World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider. And then the National Institute for Mental Health defines self-care and talks about it as, when it comes to your mental health, self-care helps you manage stress, lower your risk of illness, and increase your energy. Even small acts of self-care in your daily life can have a big impact. And I think that's a really important takeaway message from this evening, is self-care doesn't mean going on vacation for a week for yourself. It doesn't mean going to the spa for the day. It can be things as simple as taking a 5-minute walk, and we'll give some more examples in just a minute. So a lot of times what we hear from caregivers is we would love to take care of ourselves, but it's really tricky. Dr. Rosenberg and I are both parents, and we get it. Finding time as caregivers for yourself is really tricky, but it's important to recognize what the barriers are to providing self-care, so that maybe you can overcome those barriers and engage in some activities that will promote both mental and physical health. So some of the barriers, and this is not an exhaustive list, but some of the things that we came up with are having awareness to and access to resources. And it's really important to know what is available out there, whether it's for your own care, for your child's care, to support your child's education, social, emotional development, and things such as that. It's also really important to recognize health disparities such as culture, language, socioeconomic status, so that you can also figure out what those barriers are and workarounds to those barriers. Taking time for yourself is also a barrier. Time is the barrier right there. So sleeping, eating, we talk with lots of parents of newborns. Taking a shower can be a luxury by yourself, without having a child to be worrying about, if you're able to do that. Certainly financial and insurance coverage are big barriers to self-care. Having support from the whole family, particularly if you're a single parent or you have a spouse that doesn't have availability to participate in a lot of care. Proximity to the craniofacial team and additional providers. For some families, we know you travel really far to get to your treatment providers, and that can be a barrier. And then also just caregiver, physical, medical, and mental health, and being able to address those things. So we talked about what gets in the way. What can we do to take care of ourselves? Because as I just said, if you don't take care of yourself, you are not good for taking care of other people. And we always get really excited when patients and their parents or their caregivers bring in new ideas of how they engage in self-care, and the Hornbuckles can talk about that in a bit, because we like to come up with new ideas, and we like when families share new ideas with us. But this, again, not an all-inclusive list, but some of the things we came up with are acceptance. That just acceptance of what diagnoses are for your child, what the prognoses look like, and what might go into the future medical care. Setting realistic expectations for you and your family. It's really important to know your limitations and set boundaries. We can all shoot for pie in the sky ideas, but it's really tricky to be able to accomplish things if you set those expectations too high. Asking for help. Lots of people don't like to ask for help, but really is truly important to be able to function in everyone's 100% and be the best that you can be. Taking pictures, documenting, sharing your stories with others, being an educator and an advocate for your child, carving out time when planning a daily schedule. As I said earlier, even just a 5-minute walk outside or making sure you have time to shower without having kids knocking on your door is a great way to engage in some self-care. In developing a coping toolbox, so thinking about a list of preferred activities. So in the moment when you're trying to think, what can I do right now? You have a list already prepared. We always tell kids that they need to take a break or time out when they're having a rough time. Sometimes caregivers also need to take a break. Engaging in relaxation and meditation. There's lots of great apps and YouTube videos and podcasts. Engaging in mental distraction, reading books, doing yoga, listening to music. Seeking out your own therapy or local support groups, seeking out support from websites. And sometimes takes a little bit of finding and searching, but lots of great free resources. A lot of parks and district and recreation places will have free programs. Libraries will have free programs. So seeking those things out, particularly if finances are a barrier to getting in the way.
Okay. So now we're going to talk about sibling stress because siblings are affected too. And so wanting to think about the burdens that might fall on the sibling who has another sibling with a craniofacial condition. So it could vary, but these are just some examples. It could include understanding the sibling's diagnosis in a developmentally appropriate way, because this is a very complex or very, could be mature thing that's going on with their sibling who has a craniofacial condition, and trying to understand all the pieces that are part of it. Another burden is the time and attention that's placed on the sibling with the craniofacial diagnosis, and how to navigate through that and feel okay about that. Also, another burden is the impact on our interpersonal functioning. So the sibling without the craniofacial condition, how their friendships are, if they have time that they're able to do extracurriculars, the exposure that they might experience to the bullying and teasing due to their sibling's diagnosis. And then changes or restrictions to daily schedule. So if there's some like medical appointment that comes up that they have to shift and not be able to go to something that they had scheduled, how they navigate through that, and that becomes a burden as well. So it's important to be able to recognize the burdens that are on the siblings, and how we could, and then to notice if you, as a result, might see some changes in that sibling. So mood, is there an increase in anxiety, depression, withdrawal that you might notice over time? Behavior, is the sibling starting to act out or have some more attention-seeking behaviors? What about daily functioning? If you notice that they are sleeping too much, sleeping too little, napping more, changes in appetite, and then the attachment might vary. They might see a change in the attachment to the parents, or changes in their school performance where all of a sudden their grades are declining. So it may or may not be related to, but it's just always something to keep in mind and monitor and address if needed. Which then leads to the next slide, which is strategies to support the sibling stress. And so I think an important piece is to provide a space for the siblings to talk, whether it were to be within the family or to give them a space elsewhere for them to be able to talk about their feelings and thoughts. Make sure that the siblings are given their own attention and regular check-ins throughout their childhood, and it's ongoing because things could change. Providing ongoing education and language about the craniofacial differences. So as they get older, they might be able to understand different things, or different things might be happening that is important to provide them information about. Also, I think it's helpful to try some different things, like you could role play how the sibling could respond to questions. Have some readings about the craniofacial condition, pictures, images related to it, and then involve and that just helps them to process everything better, having that visual. Involving the siblings in craniofacial care and appointments. There's times where the whole family comes, and we embrace that and have them included if they want to, and everyone allows it, to have the sibling part of the medical appointments. And then if needed, if you're noticing those changes in the sibling, getting the mental health care that they might need. So that could be through therapy or support groups of their own. Supports for the entire family. So just to kind of like put this all together, and it's so essential. No one in the family functions in isolation. So that's really important to keep in mind, but also finding the balance. And so thinking about what are the strategies to foster communication in the family. So it's important to identify and be aware of your family-specific cultural and beliefs and backgrounds and how that might impact different things, such as their perceptions of the diagnosis, how they communicate, the care that's related to the child with the craniofacial condition. Also set roles and expectations for the medical care, deciding who's going to do the feeding and when, who's going to schedule and attend the doctor's appointments, who's going to care for the sibling while they go to the doctor's appointments. And then it's really essential to be able to engage in listening versus hearing. And there's a difference. So the listening is being able to process and follow through rather than just hearing what someone is communicating to you. Trying not to be defensive or accusing or overprotective, just keeping that in mind when trying to communicate with each other. And the importance of using I statements to be able to express your thoughts and feelings. It sounds so simple, but it goes such a long way when you're trying to communicate something, and being able to give it in the I statements is really good way to foster communication. Communicate the needs for self and others, and do it clearly and simply, so that it doesn't become too much at once or too overwhelming, and that everyone really understands what you're trying to communicate. For older children, setting a time for family meetings and for check-ins, keeping all of the family members in the loop. And that's all the time, because things change. So as everyone gets older, you just want to continuously all be on the same page and keep everyone just informed of what's going on. Problem solving, to encourage that the goals are met in a consistent way. So if you come across some challenge, it's not, something that you just have to accept. Let's figure out, how do we solve this? How do we all work together as a team? Because the family is part of the team, as well as the other team, such as the Craniofacial Center. Everyone is there to help for problem solving. Everyone needs to be on board with the plan, and that really is to help success. So if you feel hesitant, speak up, communicate. Communication is not limited to the nuclear family. Also include extended family if you need. And then seek outside support to promote communication. And that could be with the craniofacial team, with a family therapist, with a pediatrician. And the examples of that are just asking questions, asking clarification, asking for help when you need to. So now I want to introduce you to the Cooper family. They created this video to share their story with you all.
Cicely Cooper.
I'm Roland Cooper.
I'm Hannah Cooper. And we adopted Hannah from China when she had just turned 2 years old in 2015. So we knew that she was coming home with a unilateral cleft lip and palate. So it was definitely the start of a big journey, right, for all of us.
Yes. So thank you for the introduction process. What challenges or what burdens do you feel like you encountered initially?
It was the limited communication that we could have with her. If we'd have been with her since she was a baby, obviously, she still wouldn't have understood too much about what was happening, but she could have at least had that comfort of really being familiar with us and us really being able to like prepare her more and communicate with her. It was hard with some of the aftercare that we had to do for the surgery. So
as you go through the years, any other burdens or challenges that kind of come to mind?
When she was much older, much more familiar with us. So we really feel like we've been so lucky with subsequent surgeries. Everything's just gone so smoothly.
Just normal stuff, really.
Just kid stuff, nothing that seems specifically to do with the adoption or the
anything that you found useful as you were going through this whole process?
Yeah, so we have right from the start, like the team at UIC has been so fantastic. We have definitely gotten so much out of and Hannah has too gotten so much out of our relationship with you, Dr. Rosenberg and Dr. Patel, and that's like a resource that's been very valuable to us. And the other thing I really wanted to mention was we made a lot of use out of the early intervention program, which we could use up until she was 3 years old. So that was like such a huge resource for me. She saw speech therapy through them, and she also saw a psychologist through that program, and was really helpful to her. But to me, it was a lot of support and tips on like how to bond with her. And
yeah, it sounds like getting the support from the team, also outside resources that were helpful. In terms of strategies within the family and then extended family and communication, what have you found to be most useful?
We're pretty good at communicating. We have like a Google shared calendar for all to keep track of all the appointments between like check-ins with the team and then dentist, orthodontist.
Found a system for you guys, which is really nice.
But
Hannah, what is your first memory of something related to your lip and palate?
Being in a pink plastic wagon thing.
So this was when she was checking in for her first surgery, her palate closure. And while she was getting like checked in and waiting for pre-med and everything, she was in one of those like wagons with her little blankie, and they were like pulling her around.
That's so cool that stuck with you. What's the hardest thing that you've experienced with having a clap?
Getting teased for like, because my lip isn't even.
And wondering, like, what have you done to help to feel better about that?
If kind of like when people ask, I'll tell them about it.
Yeah. So you're sharing your story. Are there other positive things that you do just to feel better anytime?
I like to read with my stuffed animals.
Yeah, absolutely. Which, speaking of, I brought someone for you.
Really?
And she wanted to say hi, and she's always there every single time Hannah and the family come. So I hope, is there anything else that you guys want to share?
Tell them real quick about the Ocelli coping kit.
Oh,
It looks like a plump H. And then like it's got like a zipper so that you can put like worries or like the cards in different subjects.
Just a little background, the Celly is this coping kit that was created actually at UIC and that we gave to some of the families to learn about CLEP diagnosis in general and how to cope and things to feel better.
That was a really good resource for us all as a family. I think understood her condition and was able to like explain it to others when they asked, and that just gave her confidence. And but also like helped, was a resource that helped us like knowing how to approach what she needed at school and
the upcoming surgeries as well.
All right. So I wanted to share just quickly about the Celly because this is just an example that we have at our clinic. And it, like I mentioned, it has a parent booklet and a Celly coping card. And this actually was created through the Celly that was first for sickle cell, and then they did other medical conditions. And so it's been a great resource. And I love that like Hannah and the family found it useful. But I would say every craniofacial team might have resources available. And that's where it could be so useful to ask these kind of questions and see what they could have to give further support.
Awesome. Thank you. So just as we're wrapping up here, some of the things to think about is where do we find outside support? Because a lot of families, and I know all of you are coming from such diverse geographical areas across the United States. And if you're in an urban area, it's probably much easier to find resources than if you're in a rural area. But pediatrician can be a really great first point of contact because they're generally going to be most familiar with what's available in your area. And so you just saw in the video, early intervention was mentioned. Just about every state, it's different names in different states, what those early intervention services look like. I think it usually consists of speech therapy and a developmental therapy and occupational therapy and physical therapy. And a pediatrician is a great way to get connected with those services early on in life. pediatricians can also refer for therapy, mental health services, sometimes respite services. And a lot of pediatricians will have case management available in their practice to help with this searches. Also, sometimes going back to schools can also help with some case management services. So another great place to find outside support is through the schools. Working with your child's 504 plan, their individualized education plan, working in your school district to figure out who maybe an academic advocate might be. A lot of school districts will have those folks in place, making sure your child's just getting general academic support, therapy support. A lot of times, if there's a school social worker or a school psychologist to help provide things at school, can take away those burdens of having to get to therapy appointments after school, looking for advocacy support. And again, advocacy in the schools, finding out who those people are and what role they can take to help you. Certainly working with your craniofacial team is another great place to look for resources. That can be advocacy resources, referrals for therapies. Orthodontia is certainly a practice that's targeted a lot by patients that both Dr. Rosenberg and I treat, working with sleep studies, genetics, dental groups, particularly dental and orthodontia groups that focus on kids with diagnoses that fall under a craniofacial condition. Your craniofacial team can be really helpful in providing psychoeducation, therapy services, and again, we just want to give the disclosure, different sites and different practices offer different available practitioners with their groups. And so even if your team doesn't offer some of these services, they will know where to point you in the direction to get these services. And then also support groups. We'll have in the next slide, there's some great social media support groups. I always just let my patients know, just, check with a caveat, because you want to make sure you're with a legitimate group and not groups that are not going to serve their purpose. MyFace has some great virtual support groups. There's live support groups at different medical and mental health facilities, and family-to-family support. One of a great resource that we use in my hospital is that if a family is struggling with something or looking for resources in the area, we'll try to connect them with a family that has similar issues or lives in a similar geographic area so that they can find those supports. And then our sample online resources, this is just such a small snippet, but MyFace obviously has lots of great resources, as most of you know. If you go on the American Cleft Palate Association's website, there's really great parent resources. There's letters and templates you can use to advocate for your child at school. If you're looking for letters to request 504 plans or IEPs, a lot of those can be found just with a quick Google search. There's lots of different Facebook groups. Two of the groups that we've been told are great supports are the Cleft Mom Support and the Cleft Lip and Palate Association's Facebook group. And then also center specific. And we can't stress enough making sure you go back to your team and your providers to help you with resources. And these are just a list of places that we found to have really nice websites that provide those resources. So we want to thank everyone. It's a lot of information to pack in a really short amount of time. And I'm going to go ahead and introduce the Hornbuckle family now. I've had the pleasure of working with them for many, many years, and they've had a lot of really great experiences and a wealth of knowledge that I think they're going to pack in and share with you as well.
Hello, thank you for having us. Just a little background about Terry Lynn and Evan's journey. Actually, Terry Lynn is 11 years old, and we found out in an ultrasound that she was going to have a cleft. So we did actually a lot of things to prepare for it, which I would say probably was a huge, huge benefit. And knowing the diagnosis early and being able to plan. Then we had a couple struggles in between Terry Lynn and having another child, and Evan became our miracle baby. And never in a million years with the 2 to 5% of having a second child with a cleft, when there was really no history for either of our families. We could clear as day see that cleft in our 20-week ultrasound. So when we talk about stresses of having a first child, and then thinking, you know what, it's probably not going to happen again. And it does happen again. It's really nice to know that the care we were getting for Terry Lynn, we were able to pick up the phone and let them know that they would be seeing another child again from us for that treatment. So both of our kids were born with cleft lip and palate. Terry Lynn was unilateral left side and Evan was bilateral. So every cleft is totally different. You like that? Some of our highs and lows, just I could probably have had a slideshow of a million pictures, because one thing that we feel very, very passionate about is sharing our story, trying to help others, because again, you have the one child and don't expect it the second time. And a couple of these pictures here that just really hit is, the surgeries. It's always very difficult to see your child have to have surgery. And you think as an infant, it's very hard and difficult. But I will tell you, and maybe Terry Lynn can talk a little bit, but once they get older, it actually is a little bit more difficult because now they are realizing things and they are able to talk to you and tell you how they're feeling. So, Terry Lynn, how was it with your recent surgery a couple years ago on your bone graft?
It was hard because there was one point, like, I woke up and I had to use the bathroom. So Mom helped me into the bathroom. So then I looked in the mirror and I started crying because my face was all swollen and it was like.
Yeah. So, those are the tough moments, where the kids can actually tell you how they feel. That makes it a little bit more difficult. And then we got this silly goon over here. Some of the difference in the highs and the lows too is with Terry Lynn, she actually had what we would consider so far a pretty smooth journey. There's typically 4 surgeries that a cleft patient will have on the good side. She's only had to have the one lip repair, the palate repair. But Evan, he had to have 4 surgeries within his first year. So again, every journey is a little bit different. And for him, I think one of the biggest just lows is, not really having the time. Sorry, not really having the time to get over the first surgery. But because you're just then preparing for the next one. So I do have to say we've been very blessed with our biggest high is our team. Some of the things that the doctors mentioned today is you have to really trust your medical team and your medical professionals, and we wouldn't choose any other place than where we are going right now. And it's just been amazing to know that we can depend. Some of my least of my worries are actually the surgeries, because I know they are going to do a great job and take care of our kids. But there's all the additional stresses afterwards. Terry Lynn, you want to talk a little bit about your book?
Well, stop. Well, the picture at the bottom under the highs and lows with me holding the book, I was in preschool and it was like show and tell or something. And I brought in my book. So then I was telling all my friends and everyone in my class about like the cleft and how it was like going through everything I went through so far. So.
And that's one just for any parents that, you know, may be listening. One of the biggest things as a parent that we have to do is build confidence in our kids. And when we know that our children have that confidence, it reduces a lot of stress off of you. And one of the very, very, very first things when we started this journey with Terry Lynn, when we stepped into Shriners, was they said to us, you need to be open about this. You need to tell people that your child's going to be born with a cleft lip and palate. You need to, you know, acknowledge it. And that was probably the best piece of advice that we got. It wasn't going to be anything that we were ever going to hide. But it was just something that always stuck with us, and making sure that you're open about it, because in those moments where people are staring at your child in the store, you know, you have to be ready and prepared to answer and explain to them what we call in our family is their trademark. So for both Terry Lynn and Evan, we tell them they have a special trademark and a special smile that they get to share with the world. And also, too, they have had 2 smiles that they've had since birth. And for Evan, he's actually had about 3 due to the several stages of surgeries that he's had to have. I really wanted to plug in these pictures from an advice perspective to really continue around the importance of building confidence in your kids. For every surgery that we did with them, you can see the shirts that we had made, just encouraging. Yes, that's you on the picture. Encouraging them that they're strong, that they're brave, that they're amazing. You know, they're. Yes. They're. Sorry, he's more amazed by checking out his pictures here. And 2, like their middle shirts, you know, my brother is my superhero, my sister is my superhero. Them having that support is really important. Charmaine, I actually see your comment on trademark. You love that. I do think, please share it, please use it. It's a special gift that these kids have, and they should be proud of, you know, who they are and be comfortable in their skin. A couple of stress reducers that I would, you know, just love to share with everybody is being open about your journey. That is really, really, that's really, really important. Making sure that it's not something that's hidden, because your kids will notice that. Also, too, having a good support system. I have to say that we are beyond blessed with amazing family that is local, that is close. Daddy couldn't be here on screen with us tonight as he's working hard. So we have a wonderful support system, from my spouse to family to friends. That third bullet, it is very, very, very important to not be afraid to ask for help. Both of our kids did have to go to daycare, and we were teaching our daycare people how to feed them correctly, how to, you know, make sure that they weren't choking. Terry Lynn was unable to suck, so we had to use a squeeze bottle with her back in the day. And I know Dr. Albert had mentioned some strategies and things that, you know, we've done sort of while you're going through these journeys, trying to find things that will help you. And that was creating a bottle that we were given, but utilizing the syringe that was given to us to help make feeding for Terry Lynn much better and much easier for us. And then the joys of a 6-year-old, everyone. And then also too, just really, I remember teaching my parents how to feed the kids for the first time. You saw the picture of Terry Lynn feeding Evan. Now, feeding for Evan was much different for him with the way that his cleft was. But it's important. You need to find time away. I know both of the doctors mentioned that, but you have to step away. You have to get away from the situation sometimes. And music to me is always and has always been a therapy. We also found theme songs for our kids. So things that, through our journeys were songs that motivated us or kept us going. Also knowing that you're human, because guess what? You're going to cry, you're going to get angry, and it's okay. It's okay to do that, just like I did here. But building the confidence in your kiddos is really, really important. And after all is said and done, no matter how difficult it is during those times of surgery, in those moments, it really is quite amazing that you see their strength. And it just makes you even stronger, because if they can be that strong through all of it, then how can we not be?
Thank you, thank you, thank you, April, Terry Lynn, and Evan. What a beautiful story. You are a shining, living example of all the right things to do, and just so lovely to have you share that story and know how important your team is, and having the right craniofacial care team is just vitally important. So thank you for all of that. I want to thank Dr. Albert and Dr. Rosenberg for sharing the wonderful presentation. Let's jump into some Q&A. We just want to remind you to make sure that your questions are general. And if you have a question, go ahead and type it into the live chat on your Facebook or your YouTube stream. So let's just jump right in. I'm going to start with a question for Dr. Albert from Blagovesta. And the question is, my son's upcoming surgery is causing me a great deal of anxiety. How can I better manage my intense fear of surgeries? I want to be able to actively manage my own emotions so that I can be strong and reassuring presence for my child.
That's a great question, and something that is very common with all the patients that we see. And I bet April would remember one of my colleagues who works with me or myself telling parents, and again, when your child is an infant, guess what? They're not going to remember their surgeries. It's the adults that have to take care of themselves through those first year or two of surgeries. And so I think one of the most important things, regardless of what age your child is you do need to manage your stress around it, because whether you have a 3-month-old, a 9-month-old, a 6-year-old, a 13-year-old, or a 19-year-old, our children pick up their cues from our stress. So even if you think you're managing it well, but there's a lot of tension, a baby is going to feel that, and even a teenager is going to feel that. And particularly someone who's like Terry Lynn's age or Evan's age, like, why are mom and dad feeling so stressed? Do I have something to worry about? So I think the most important point is stressing how important it is to be able to manage that stress, and then figuring out a way to do it. And I think one is educating yourself. So talking with your team. We always suggest, and I think Dr. Rosenberg would say the same, don't go searching Google for the answers of what your child's surgery is going to look like. Call your providers, because what happens for a surgery in a child in California is not the surgery that a child in New York is having. And so it's really important to get specific care answers for your specific child. If the stress and the anxiety that you're feeling is so overwhelming, then it's not a bad idea to go see your own internal medicine provider, seek out therapy, so, resources for yourself, because again, the more that you can cope with your own stressors, the more available you are with your child. And then certainly things like day-to-day coping skills, and we've listed some of those. Self-talk is a great one. And just reminding yourself, my child is going to be okay. I think April, hit the nail on the head. And I hope this is the experience for most people, knowing that you can go to your provider and that your child is in good hands, and reminding yourself about that all the time.
Thank you, Dr. Albert. Okay, a question for Dr. Rosenberg. I am a single mother working 9 to 5 with no flexibility in my scheduling. My infant son has frequent medical appointments, and I'm the only one who can take him to the hospital. I was able to get time off to care for him using the Family Medical Leave Act, or FMLA, and that's been used up now. And I have no remaining time to take my son to his medical appointments. What options are available for people in my position? I'm afraid I'm going to lose my job.
Yeah. Thank you for that question. And it sounds like this is, of course, a very understandably overwhelming time as you adjust to everything. And then not just have a child is born, but a child is born with a medical condition. And being a single mom is that extra burden and stressor that you're experiencing. And so, I mean, one thing, if possible, just don't go through this alone. So even if it means getting support emotionally, if it sounds like it mentioned that she's the only one who could take them to the hospital, but seeing what other options there be to have other people to help to get you through this. Communicate with the job. I don't know what the options are, but I think given the circumstance of having a child with a medical condition and it being an ongoing journey, sometimes there's options that you could work with in terms of flexibility with hours or whatever else you're able to set up with the job. And then, of course, communicating with the team. So I know our clinic and many others probably try to set things up to help with the families as much as we can, because you're missing school, you're missing work. Being able to see everyone all at the same day, or having an early appointment or a late appointment. But the more that you let the providers know, we are there to be able to help, because we do not want a job to be jeopardized. And then kind of the same theme that I know Dr. Albert said, and just we're hearing throughout, is take care of yourself, because it's going to become more overwhelming if you feel like you're experiencing all this stress. And that if you can't deal with that, it's going to be hard to figure out how to problem solve and communicate to come to a good place.
Okay, thank you. Here's a question either for Dr. Albert or Dr. Rosenberg. Let me just see here. And actually, I would ask Terry Lynn, if you want to weigh in on this, I'd like you to do so. But kids responding to comments from other kids, how to make this a learning experience? Any advice on that?
Terry Lynn, can we put you on the spot? Because I think you've come up with good ideas in the past. So if you could think of one thing, maybe that if kids have made comments in the past or even have questions, how do you respond to that?
Well, if you have like something and they ask, like, if they ask it in a rude way, just say it nicely. But if they ask it in a nice way, just say, "Oh, I was born with it," or "This happened to me when I was younger," or like just explain how it happened, or like if you were born with it.
And I think that's perfect advice. And I think what's really important for parents as ways to support their children and siblings from a young age is to give language. A scar from a cleft surgery is not a boo-boo. It's not an owie. We want to label it for what it is and give kids and their siblings the ability to describe it and explain it in a confident way. And I think that was really expressed nicely tonight, is that the more confident kids can be about it, the more it's not such a big deal. We talked about, in one of the slides Dr. Rosenberg covered, doing the role playing. That's really helpful, so that when you're asked questions, you can figure out, and kids automatically have responses. Kids, when they're confidently answering things, it's always like, oh, that's like not such a big deal. And one thing I always let patients know is every child has scars if it's a question about scars. And it might not be a scar from a cleft. It might be from jumping off the playground, and cracking your head open and you've got a nice scar from stitches up there. But being able to find those commonalities. Do you have one of those, Evan? One of the, commonalities of that we all have scars. And maybe my scar, this is where it's coming from. They come from different places, but it makes something that can be similar about all of us.
Terrific. Thank you. Here's an important question from Amanda, and I think either doctor, but maybe April, you might have a perspective on this as well. Pre-op appointments are becoming very emotional and tearful for our 7-year-old. Are we doing more emotional damage by allowing him to leave the room and discussing the health plan with him in a more comfortable setting later at home?
That's a big one. You want to tackle that? That's a big one. Dr. Rosenberg, do you want to tackle that for a minute? And then April, you can let us know what you think from the parent perspective.
Yeah, it's so much harder as a child gets older and they become more and more aware. So when they're a baby, it's all on the parent and the caregivers to experience it and feel strong, right? As the kid gets older, and they're kind of part of that process, and it's weighing do we include them or do we kind of like try to protect them in some way? And that's a really hard decision. I think, and this is what I always encourage, just from the start, I think it's so important to share the story with your child so that they understand their story and what it all means to prepare when they have to go to a doctor's appointment. So I think a lot of preparation might help before you go to the doctor's appointments and get ready for the surgeries. And even having them, like, maybe they can make a list of questions. So if they become involved, that's something that might ease it becomes overwhelming when they might get to that appointment and hear all this information. Afterwards, giving them a chance to process it. So I don't know necessarily if I would say have them leave the room, but maybe just getting a sense. Each child is different. So he might be the type where you prepare him beforehand, and he might not be able to be in the room right away, but gradually getting to that point. If it's so concerning, there are psychologists, social workers on every team, and they can give additional visits. They can even meet on those days when they're going to be meeting with the surgeon, and then help them with being able to manage the anxiety better. I don't know if anyone else wanted to add, but those are my thoughts that came to mind.
Yeah, and I think I would definitely second those. I just really can't stress enough how important it is to have them involved in their journey. And again, I'm not sure if you do a lot of pictures with them or sort of take them through this, maybe just even introducing them to some others. I know our contact information was on there from an email perspective, and maybe just to talk with another person, another patient going through the same type of things. But definitely, I mean, I would keep them involved in their care as much as possible, because again, you don't want them scared when the next time comes that there's surgery and what's coming on, what's happening. I will tell you, my 11-year-old over here is very inquisitive. Allow your 7-year-old to ask the questions. Terry Lynn asks a lot of questions, even when we go to the dentist or the orthodontist. What are you doing? What are you putting in my mouth? Why are you doing that? What's next? And you know what? It's okay, because they should know what's being done to them and it shouldn't be hidden. So hopefully that helps a little bit.
Yeah, I agree with that so much, April. April, I want to ask you another question. Can you speak to how your children have supported one another and what lessons you've learned from their special bond?
Okay, these two actually have a wonderful relationship. Every sibling has their battles, but I will tell you, when we realized that our second child was going to have a cleft also, one of the first things I said is, Terry Lynn's going to be able to see this journey of Evan's and see what she went through, because she was so young not to realize what she had gone through. They both support each other. They both, again, I can't say enough, the trademark. I mean, that's really our main focus on, their smiles and what they have to share with the world and who they are. But they definitely have their moments of parent or sibling non-love, but ultimately she is a wonderful big sister. We now are able to go to our CLEP team visits at Shriner Chicago together, which actually makes it really nice too. They can each sort of see where each other is in the journey. And yeah, I mean, it's been helpful for us too as parents to see them support each other.
Thank you, April. So I'm going to ask Terry Lynn. I'm going to ask you, saving the best for last. Based on your own experiences, what advice would you give to other kids who have a sibling with a facial difference? How can they help their brother or sister feel more supported and understood?
Well, I feel like you should, if the sibling, well, if you don't have a facial difference, but you have a sibling who does, try to like hang out with them more, because then you can understand them more and you can get what like they're saying if they do like speech therapy and all that, and it's harder for them to talk. You can like talk more with them, and you can
We'll talk about being part of their therapy. So Evan had to do feeding therapy. So how did you help with supporting that?
I honestly don't remember.
You don't remember? Okay.
But you're a really good big sister. I can tell that. And you've got a really awesome little brother. And I just have to say, thank you, April, Terry Lynn, and Evan. And thank you so much, Dr. Albert and Dr. Rosenberg. This was an amazing presentation. And I sure hope everyone enjoyed this program tonight. I do apologize that we couldn't get to everybody's questions, but if you'd like to ask additional questions, please reach out to us at info@myface.org. At MyFace, we strive to provide the most helpful and informative resources. To help us to do so, we ask that you take a few moments tonight to complete the brief survey by using the QR code provided or by visiting myface.org/family support webinar and let us know your thoughts about this evening's program. We will also provide this information in a follow-up email you will receive after the program. MyFace provides important direct services that offer guidance, resource, and a supportive environment for all who participate. For more information about the programs and services that we offer, please visit us at myface.org. The next episode of our MyFace, My Story podcast will debut on February 15th. This episode is entitled Rebuilding a Life After Facial Cancer and will feature Dina Zuckerberg's interview with author Kathleen Watt. Please visit myface.org/mystory to register. MyFace also offers a series of free virtual support groups for members of the craniofacial community. There are 6 support groups in total. There's a parent support group in English and one in Spanish. There's a support group for expectant parents and parents of infants. And then there are also support groups with individuals who live with a facial difference, including adults, adolescents, and a new drama therapy group for youth ages 10 to 14. Our annual MyFace Celebrates Gala will take place on Wednesday, June 5th in New York City. Please join us for musical performances by our MyFace stars and an awards ceremony in this benefit for the craniofacial community. And coming this summer in 2024, we will have the next installment of our Transforming Lives webinar series on the topic of diagnosis and management of craniofacial microsomia, featuring Dr. Carrie Hike and Dr. Craig Burkfield of Seattle Children's Hospital. More information will be available shortly on the MyFace website. I want to thank you all again for joining us this evening, and I hope you have a wonderful night.